So you would not like to see your condition like this. You are combing very happily with joy and love, and when you see your combing brush, you get shocked. No woman would like to have her comb with full of hair. So what to do? So let's talk on what are the causes of female hair loss and how you can manage, means what is the treatment of female hair loss. We'll talk on that today. So female, mostly when it occurs, usually just after the puberty, means around 20 years of the age, and near the menopause, means around 40 years of the age, female usually suffer hair loss during this period. Most of the female after 50 years shows hair loss. Now, what are the causes of female hair loss? The most common cause of hair loss is androgenetics. There can be the androgens which can be responsible. Mostly it is seen after the menopause because the hormone level changes. Then second common cause in female is the telogen effluvium. Because of the chronic deficiency or stress or iron deficiency or some disease, she notices excessive hair loss. Like sometimes the anti-cancer treatment, if they are taking chemotherapy, then they show the massive hair loss. So that is the effluvium, that can be anagen and that can be telogen effluvium. Then alopecia areata, scarring alopecia, and many other causes of. But most common in female is the nutritional deficiency, iron deficiency, protein deficiency, B12, vitamin D deficiency, and androgenetic alopecia. Now we talk is the female pattern hair loss. What happens in the female pattern hair loss? There is a central thinning of the hair. How it presents? First of all, female complaints of that there is a central thinning, scalp show is there, and anterior hairline remains intact. That's how it looks. How it is different from the male pattern hair loss? Male has got a pattern, the anterior hairline recedes and there is a thinning over the scalp. But in female, there is a widening of the part line and anterior hairline remains intact. That is the difference between the male pattern hair loss and the female pattern hair loss. So the various classification has been given, how they look, we are not going in this. This is the pattern of female hair loss. There is a thinning and you can see the top of the scalp. There can also be male pattern hair loss in a female, means the receding of the anterior hairline and the deepening of the frontotemporal area. Then clinical manifestation, what are the most common complaints done by the females during the hair loss is that first complaint they say is there is a loss of volume. They say that the hair bulk has decreased. When they used to comb is to be very thick. Now the hair volume has reduced. There is a gross thinning in the hair. The growth of the hair, means the length of hair has become very slow and they have become shortened. And now we can see the scalp is visible, means the scalp show is there. And she notices or complained that in the bathroom or in the house, that is the house floor is covered with her hair totally, and the bathroom drainage is blocked by the hair, lot of hair. So how to manage a patient of female hair loss? First, we ask the history, means we ask what is her problem. Examine the scalp also. We ask she has done the dieting or not, was she sick before. So detailed history, local examination, and some investigation like the vitamin tests are being advised. If we suspect some hormonal problem, PCOD, then we advise them the hormone test also. How on dermoscopy there is a thinning miniaturized hair we see, that is a diagnostic feature of female androgenetic alopecia. Then what is the treatment? Treatment depends on the cause underlying. If it is androgenetic alopecia, then the main treatment is the Minoxidil. But on investigation, we find that there is a deficiency of ferritin, means iron, there is deficiency of B12 or vitamin D or some other problem, then that should be treated. Nutritional deficiency, too much of the stress is there, then accordingly the treatment is done. So Then counseling is one of the important aspect or one of the important treatment in the female hair loss. We see many of the women when they come to us, they start crying because female think that for them it is a sign of femininity and they love their hair. So first of all, you should understand that do not worry if you are having the hair loss, you have come to a doctor. He will solve your problem. He will fix your problem. It's not something which cannot be taken care, which cannot be solved. So a female who is facing the hair loss, she should consult a doctor. She should understand this is a treatable problem. This is not untreatable problem. Minoxidil is the important treatment for androgenetic alopecia. For female, 5% minoxidil solution or a foam is applied in the night over the hair root. Then the result comes after the 4 months. Then this is US FDA approved treatment, that is a minoxidil. It has to be applied over the dry scalp, night 5% or twice a day 2% is advised. There can be some side effect of the minoxidil. The minoxidil, most important side effect of the minoxidil is that there can be allergy. And it has to be applied for the longer period. Another thing is there can be facial hair growth, increase in the facial hair growth, which is very important for a female. Why it happens? If the minoxidil solution trickle over your face, forehead, cheeks, or after applying the minoxidil with the same hand you touch your face and minoxidil gets applied over any part of the face, the hair will start growing. It's a sign of worry, but don't worry about that. You stop doing this thing, the hair will automatically go, they will disappear. Or if you are facing too much of the hypertrichosis, in that condition you consult your doctor and stop minoxidil for some time, learn and understand how properly it should be applied. Or if you are applying 5%, then you can go down to the 2%. That's how you can solve this problem. So this is the results. This girl was having the ferritin deficiency and other vitamin deficiency we applied, and she was also advised for the minoxidil correction of the nutrition. This is a nutritional deficiency. You can see the results. Just ferritin deficiency, we corrected her diet, vitamins, ferritin, and she got the result after few months. This is a wonderful result. Then another case, again female pattern hair loss, androgenetic hair loss. She was given the treatment, thinning of the hair. Now you can see how the hair would look good. This is another case in which the widening of line is there. After treatment, the hair quality is better and there is a narrowing. There is a gross improvement. Now hair transplant. When the hairline becomes thinned out like this, then transplant can be done. It's not that only men have got privilege of getting the transplant. Many of the time the female are not knowing that the transplant can be done. Yes, transplant can be done for the female also, and transplant is totally successful, and they need not to shave complete head. What is their problem? Here is the thinning of entry hairline. Enough hairs are not there. Hairs are dead. In that condition, we did the transplant and we boost up the entry hairline, and you see the result. How nice it looks. Similarly, is another case after the hair transplant. This is another case in which we have done the transplant. This is the receded antennal hairline right from birth. Now you can see her forehead become. This is another case in this same lady, I think. Yeah, her forehead was broad, means receded antennal hairline was there. We did the transplant in this condition, and how beautiful it looks now. This is the same patient. It's another case of hair transplant. Then we come to the nutritional therapy. Yes, nutritional therapy or nutritional treatment is a very important treatment for the female hair loss, because most of the female, they do not consume food properly, because they are taking care of their kids, they are taking care of their husband, and they neglect themselves, and they eat at 3 o'clock in the day. Sometimes they miss their meal. Iron deficiency is the most common in the female. So the nutrition supplements, iron correction and all has to be done. Then low light laser therapy is also available, in which a 560 to 800 nanometer wavelength is given, infrared, and that also works very well in initial stages of female pattern hair loss. There are enough paper for this. Now they come the PRP. Everyone knows about the PRP. It is becoming very common. The females who has got thin hair, diffuse pattern of hair loss, or female pattern hair loss, they are being advised and they are benefited by platelet rich plasma therapy. So this was the condition of, so you understood, I explained you female pattern hair loss. Most common causes of female pattern loss: androgenic, nutritional, stress, iron protein deficiency. So they should be corrected. Sometimes the PCOD problem is there. There is a central scalp thinning is there. The main treatment of female pattern hair loss is correction of nutritional deficiency, correction of any, if hormonal imbalance is there, that should be corrected. And for androgenetic cause, the minoxidil is the main treatment of female pattern hair loss. The female in which the hair has lost permanently, scalp balding is there, scalp show is there, which is prominent, they also can undergo hair transplant. Thank you. If you have got any question, you can call us or send the inquiry for it. Thank you very much.